Ed, I know that since my announcement yesterday that we would be moving to phase 3, that you all and folks across the state have been very interested in what that is going to look like. The new proclamation, which will go into effect tonight, will outline the restrictions that will be in place for phase 3, and I'll highlight those for you. Restaurants, churches, salons, spas, gyms, other businesses, generally speaking, will be able to open at a maximum of 75% of their occupancy, but with social distancing required. We do know that when it comes to bars, they've been closed for on-premises consumption. We've done what we could to help them to realize some revenue, with 2 of the 3 video poker machines that they have them remaining open, the ability to do drive-through, delivery, curbside pickup, and then the option they have if they have a kitchen to get a license to operate as a restaurant and then follow all the restaurant rules. But we know that there's still a number of them that have been closed for on-premises consumption, and that we wanted to provide a responsible framework for them to open as it is safe to do so. And we've been looking at the guidance coming, for example, from the coronavirus task force and so forth. So what I have decided to do is that we're going to have bars remain closed on premises consumptions in parishes with high incidence of COVID-19. And as I mentioned, that's a continued recommendation of the White House Coronavirus Task Force. And especially, you're going to see some slides later that talk about the growth in cases as it relates to different age groups. And I think when you look at the 18 to 24 age group specifically, you're going to see why this is, or at least one of the reasons why this is so important, that we make sure that we don't open those for on-premises consumption where you still have a high incidence of COVID-19. But in those parishes with a positivity rate of 5% or lower for 2 consecutive weeks, they may opt in. So the parish government will have to opt in to on-premises consumption of alcohol at bars. And if they do that, the bars will be able to open subject to a number of restrictions. We'll go through those in just a moment. The 2-week percent positivity is updated every 2 weeks by the Department of Health. The next scheduled update is on September the 16th. If and when reopened, pursuant to this order, bars will be able to open at 25% capacity up to 50 people total. Indoors, customers will have to be seated for tableside service only. In addition, they may have no more than 50 customers outdoors. Social distancing is required indoors and outdoors. And again, if outdoors, they have to be seated for tableside service. Live music will continue to not be allowed. All drinks will have to be ordered at the table and delivered by bar staff to the table. Again, patrons must be seated. A sale and service of alcohol at bars, when they reopen, will end at 10 p.m., and patrons will be cleared from the building by 11 p.m. When this happens, those individuals younger than 21 will not be allowed in a bar. So those 18, 19, and 20-year-olds will not be permitted in the bars. For other social gatherings indoors, such as weddings, birthday parties, and the like, they're going to be limited to 50% capacity with a max of 250 people, and obviously the social distancing requirements that go along with that. Outdoor crowd sizes are limited to 50% capacity of the outdoor space up to 250 people if folks are going to be in close proximity and social distancing isn't possible. Casinos will stay at 50% capacity and 75% of the gaming position, so that will not change under the new order. Alcohol sales for on-premise consumption at all of these venues is going to end at 10 p.m. When we go to phase 3. It includes bars, as I just mentioned, but it's also going to include restaurants, event centers, reception halls, and casinos. Sporting events like college, high school football, and so forth will operate at a lesser capacity of 25% with social distancing required and without alcohol sales. The statewide mask mandate remains in place. The order continues to recommend the most basic of all of the CDC recommendations, and that is those at higher risk of severe illness from COVID-19 continue to realize they are safer at home, and they should not go out and certainly should avoid large crowds unless there's some sort of essential activity that they need to engage in, such as getting food or medical care. And this order will be in place for 28 days, expiring on October the 9th. I know that there have been some questions previously about nursing home visitation, what that looks like going forward, and potentially in phase 3. And I want to address that briefly. Nothing at the moment is going to change for nursing home visitations. As you all know, this population continues to be among our most vulnerable and at highest risk for severe outcomes of COVID-19. And like many, many states, somewhere around 40% of all our fatalities have happened in nursing homes. And this is because there's congregant living where people are in close proximity to one another, so the virus, once it gets in, spreads more easily, and those individuals are much more likely to be vulnerable to the disease and have a poor outcome because of age, but also because of the comorbid health conditions. Now, that said, we know that these past several months have been very tough for the loved ones, but also for the residents. And so LDH, in consultation with CMS, and has been working to finalize plans for a pilot program where we're going to try to see if we can allow for some visitation. It'll be for a 28-day pilot program. It's an outdoor visitation program. And similar to the way we're going to do bars, these nursing homes are going to have to be located in parishes with 5% positivity or less, and have 0 cases in the last 14 days in order to be qualified to participate. And this is to help minimize the risk for our nursing home residents. LDH will provide additional details in the coming days. And we hope that this pilot is going to be successful and that we can learn. We also hope that there will be more and more areas that get down to 5% or below, and certainly that more and more nursing homes go 14 days without reporting new cases. But this is obviously a very delicate situation, and I can tell you that the folks at the Department of Health are putting forth great effort to make sure that we can do this in a responsible way. I'm going to invite Dr. Bu to come up now and go through some slides that talk about the data that we used to inform the decision about moving to phase 3. And then while he's up here, please ask him any questions about the data and or anything else related to health in Louisiana and COVID. So, for example, any questions about the nursing home policy or pilot, I should say, that I just mentioned, or anything else. And then on the backside of that, I'll come back up and wrap up with some updates on Hurricane Laura.